Hello, friends. Welcome back to our channel. Cancer doesn't always show itself in obvious ways, but your body might send subtle signals that something isn't right. Ignoring these early signs could mean missing the chance to detect cancer when it's most treatable. In this video, we will share 12 early warning signs that you should never overlook. Some may seem minor, but recognizing these changes could make all the difference in catching cancer early and getting the care you need. Stay tuned to learn how paying attention to your body might save your life. 1. Unexplained weight loss. Losing weight without trying, especially when you haven't changed your diet or exercise routine, can be an early indicator that something serious is going on in your body. Sudden weight loss of 10 pounds or more can sometimes signal cancer, particularly in areas like the stomach, pancreas, lungs, or esophagus. When cancer develops, it often affects how your body processes nutrients and calories, causing unexpected weight loss. Cancer cells use a lot of the body's energy to grow and spread, which can lead to a rapid drop in weight. In addition, cancer can trigger the release of substances that alter the way your body burns fat and muscle, contributing to even more unintentional weight loss. People may often think this up to stress or simply aging, but when weight drops unexpectedly, it's a sign that shouldn't be ignored. This kind of weight loss isn't a result of lifestyle changes, but rather the body reacting to something more serious. If you lose weight without a clear explanation, checking in with your doctor to rule out underlying causes is important. Early detection can make a big difference, so it's better to take action when you notice changes like this. 2. Persistent fatigue. Feeling exhausted despite getting enough rest can be more than just a sign of a busy life. Persistent fatigue, especially when it doesn't improve with sleep, may be an early sign of cancer. Many types of cancer, such as leukemia or colon cancer, can lead to this kind of fatigue by affecting how your body produces and uses energy. Cancer cells can drain energy from the body, and in blood cancers like leukemia, the abnormal production of blood cells can reduce the body's ability to carry oxygen, leading to extreme tiredness. Fatigue caused by cancer is different from normal tiredness. It doesn't go away with rest, and it can often feel overwhelming, affecting your ability to go about your daily activities. This kind of exhaustion can be frustrating because it's hard to pinpoint a cause. Many people dismiss it as stress or age-related, but take it seriously if the tiredness is prolonged and doesn't seem to have a clear cause. If you feel worn out daily and can't explain why, it might be time to see your doctor. Catching cancer early when it's still manageable can make a big difference in your treatment options. Fatigue is easy to overlook, but could be your body's way of telling you something more is going on. 3. Unusual lumps or swelling. Discovering an unusual lump or swelling in your body can be alarming and should never be ignored. Lumps under the skin can be one of the earliest signs of certain cancers, such as breast, testicular, or soft tissue cancer. Even though not every lump means cancer, any new growth should be checked by a doctor. Cancers can cause lumps to form as abnormal cells multiply and create a mass. These lumps may appear suddenly or grow over time. They can develop anywhere in the body, such as the neck, underarms, abdomen, or groin, and may or may not be painful. Some lumps are firm and immobile, while others are softer, but both types warrant attention. Many people assume that if a lump isn't painful, it's not serious. However, pain isn't always a reliable indicator. The size, location, and growth rate of the lump are often more telling. If you notice any unusual swelling or lumps, especially if they're growing or changing, have them evaluated by a doctor. Early detection of cancer can lead to more effective treatment, so don't wait to get any new lumps or swellings checked out. 4. Changes in skin appearance. Your skin can often be the first place where signs of cancer appear. While we typically think of skin cancer when it comes to changes in the skin, other cancers can also manifest through unusual skin changes. Whether it's new moles, changes to existing moles, or persistent sores that don't heal, paying attention to what your skin tells you can help catch cancer early. Skin cancers, such as melanoma, often start as small changes in the appearance of the skin. A mole may become darker, change shape, or grow in size. Other types of skin cancer might present as rough, scaly patches, or sores that bleed and don't heal. Even cancers inside the body can cause skin changes. Yellowing of the skin can be a sign of liver cancer, while redness or darkened areas might indicate other forms of cancer. If you notice a spot on your skin that's changing, itching, or not healing, it's a good idea to examine it. Skin changes might seem minor, but they can be a sign of something much more serious happening internally. Early detection of skin cancer can significantly improve outcomes, so keeping an eye on any unusual skin changes is vital. 5. Chronic cough or hoarseness. A cough that won't go away or persistent hoarseness can be more than just the remnants of a cold. Chronic coughing, especially if it lasts for weeks or months, might be an early sign of lung cancer or cancers affecting the throat or esophagus. This cough is often dry and persistent, and may be accompanied by hoarseness or a raspy voice. Lung cancer can irritate the airways, leading to a persistent cough that doesn't respond to usual treatments. Cancers of the throat or esophagus can cause hoarseness, making your voice sound deeper or rougher. If the cough brings up blood or is accompanied by chest pain or difficulty breathing, seek medical attention immediately. Many people assume a chronic cough is just a lingering cold or allergies, but it's worth investigating further when it persists and isn't linked to a known cause. Persistent coughing should be taken seriously, especially for smokers or people exposed to secondhand smoke. Don't wait to see if it goes away on its own. If it lasts more than a few weeks, it's time to consult a healthcare professional. 6. Difficulty swallowing. Struggling to swallow or feeling like food is stuck in your throat could be an early sign of cancers affecting the esophagus or throat. This symptom is easy to dismiss, especially if it only happens occasionally, but it's worth paying attention to if it persists. Esophageal cancer can cause a narrowing of the esophagus, making it hard to swallow solid foods or even liquids. You might feel pain or pressure when you swallow or notice it's getting harder to eat certain foods. Difficulty swallowing can sometimes be associated with weight loss, as people start avoiding food because eating becomes uncomfortable or painful. It can also lead to choking or coughing when trying to eat. Even if this symptom comes and goes, it's important to see a doctor if it lingers. Addressing this issue early can help detect esophageal or throat cancer when it's still treatable. Don't wait for it to become more severe before getting it checked out. Early diagnosis can significantly affect treatment options. 7. Frequent infections. If you get sick more often than usual or struggle to shake off infections, this could be a sign that something is weakening your immune system. Certain types of cancers, like leukemia, affect how the body produces white blood cells, which are crucial for fighting infections. As a result, frequent infections can indicate that your body's immune response is compromised. Frequent infections can show up as recurrent colds, flu, or more severe infections that take longer than usual to clear. If you're getting sick more often and it's harder to recover, it might be time to consider the possibility that something more than a weak immune system is at play. Most people associate infections with seasonal bugs or stress, but it's worth exploring further when infections persist. If you're noticing a pattern of frequent illness, talk to your doctor about running some tests to check for any underlying issues. Leukemia and other blood cancers can often be detected early through blood work, so don't ignore frequent infections as just a normal part of life. 8. Unexplained bleeding. Unexplained bleeding is one of those signs that should never be ignored. Whether it's blood in your stool, urine, or even coughing up blood, it can indicate a serious issue potentially linked to cancer. Blood in the stool could be a sign of colon or rectal cancer, while blood in the urine may point to bladder or kidney cancer. Coughing up blood could signal lung cancer. Sometimes the bleeding may be less obvious, like in cases of gastrointestinal cancers where the blood isn't visibly noticeable, but can be detected through tests for anemia. Vaginal bleeding outside of normal menstrual periods, especially post-menopause, can be an early sign of uterine or cervical cancer. Bleeding from any area with no clear cause, such as a minor injury, should raise concern, especially if it's persistent. Many people assume these issues are just one-off occurrences, but repeated or prolonged bleeding should be brought to your doctor's attention. Unexplained bleeding is one of the body's clearest warning signs, so seek medical advice if you experience this. 9. Persistent pain. Ongoing pain that doesn't seem to have an explanation can be a subtle yet serious early sign of cancer. While not all pain is linked to cancer, chronic pain in specific areas, especially if it's unexplained, could be pointing to something more serious. For example, persistent headaches might be an early sign of a brain tumor, while continuous pain in the bones could suggest bone cancer or even cancers that have spread to the bones from other parts of the body. The challenge with pain is that it's often dismissed as part of aging, stress, or a lingering injury. But if the pain is new, worsening, or doesn't go away, it's worth checking it out. Cancer-related pain is usually persistent and tends to get worse over time rather than improving with rest or standard treatments like over-the-counter pain relief. Listening to your body when in pain is crucial, especially if it feels different from anything you've experienced. Pain is your body's way of signaling something isn't right. So don't hesitate to consult a doctor if you've been dealing with persistent discomfort. Early detection can be life-changing, and identifying cancer early gives you more treatment options. 10. Changes in bowel or bladder habits. Sudden changes in bowel or bladder habits can sometimes be an early indicator of cancer. For instance, persistent constipation or diarrhea that lasts for more than a few weeks could be a sign of colon cancer. If you notice that your stool is narrow or ribbon-like, this could also indicate that something is affecting the colon's normal function. Any blood in the stool should be taken seriously, as it may be a warning sign of colorectal cancer. On the bladder side, difficulty urinating, blood in the urine, or a frequent urge to urinate, especially at night, can be signs of bladder or prostate cancer. These changes often go unnoticed because they are gradual, but if you've experienced these symptoms for an extended period, get them checked out. Many attribute these changes to dietary habits, stress, or simply aging, but persistent changes are worth discussing with your doctor. Early diagnosis of bowel or bladder cancer greatly increases treatment success, so it's crucial to pay attention to these signs and act when necessary. 11. Unexplained bruising. Frequent or unexplained bruising, especially in unusual areas like the back, abdomen, or arms, may be an early sign of cancer, particularly blood cancers like leukemia. Leukemia affects the body's ability to produce blood cells, including platelets, necessary for blood clotting. As a result, people with leukemia may bruise more easily, often from minor bumps or even without any apparent cause. These bruises may take longer to heal and appear larger or more widespread than a typical bruise. Some people may notice that they wake up with new bruises without recalling any injury. People with leukemia may also experience frequent nosebleeds or gum bleeding. While bruising can be caused by various factors, including medications or vitamin deficiencies, you must pay attention if you notice a pattern of frequent bruising without any reason. If this happens, consult a healthcare professional to rule out any underlying issues. 12. Loss of appetite. Losing your appetite for no apparent reason, especially if it's combined with unexplained weight loss, can be a sign of cancer. Cancers of the stomach, pancreas, ovaries, and other organs can lead to early satiety, where you feel full after only a small amount of food or a general lack of interest in eating. This isn't just about losing interest in food temporarily. It's a more prolonged loss of appetite that leads to weight loss and a decline in overall health. This symptom is often overlooked or attributed to stress or other lifestyle factors, but if it persists, it could be your body's way of signaling a problem. Cancer can disrupt the body's normal processes, making digestion difficult or painful, leading to a lack of hunger. If you notice a significant decrease in your appetite lasting over a couple of weeks, it's time to speak to your doctor. Identifying cancer in its early stages can provide more treatment options and improve outcomes. By being aware of these early signs, you're already taking a big step toward protecting your health. Early detection can truly make a life-saving difference when it comes to cancer. If any of these symptoms sound familiar, don't hesitate to talk to a healthcare professional. It's always better to catch things early. If you found this video helpful, don't forget to subscribe, give it a thumbs up, and share it with someone who might benefit from this information. Take care of your health, and we'll see you in the next video.